so that we will have the opportunity to make it available to other team members, and particularly team members whose work schedules do not permit them to attend and have requested that we record this. But wanted to thank you, Dr. Aiken, for being willing to give us some of your time to particularly answer some of the frequent questions that we've been getting from staff and kind of clear up some of the confusion that I know you're going to address around topics like quarantine, who needs to quarantine and why, what do I know if I know someone else that's quarantining, isolation, and those types of things. So I know you prepared a presentation, and I can definitely share that screen. And I don't know if you want to start by going through that, and then Sue and I can share some of the frequently asked questions that we received via the survey and on other sources. And then we can open up for questions. Does that make sense in terms of a process?
Yeah, I'm perfectly fine with that. That sounds good. And I won't spend too much time on the presentation, but I thought it would answer a few questions and give us some talking points.
Great. Well, thank you.
Sure, not a problem at all. I have great admiration and appreciation for anyone in education, not only now, but as a career. I am happy to be here and hope that this will be helpful. The first slide, just trying to clarify a couple of terms that are often used and sometimes interchangeably. The name of the virus is the SARS-CoV-2 virus. It's a type of coronavirus, of which there are many others. And the illness that is caused by it is called COVID-19. If you can pass on to the next slide. How is it spread? I think we're pretty familiar with this, but it's really mostly person to person by respiratory droplets, either by coughing, sneezing, talking without a mask on, other things that allow droplets to come out of our noses and mouths and land on sensitive mucous membranes like eyes, nose, and mouth of somebody else. Sometimes it can occur if you have touched your face after having your hands contaminated, for instance, by shaking hands with someone who may have just touched their face, or perhaps a surface that somebody had recently just coughed or sneezed on, and you wiped your hand across that by accident and then touched your face. But that's much less common. And then there is some airborne spread of the virus, mostly on the indoor setting where there's areas of reduced ventilation, and that's why we've tried to beef up the ventilation in our schools, and windows open whenever we can, and then of course outdoors is a really safer environment. Next slide. Many people have asked about symptoms, and we've divided the symptoms into major and minor symptoms. The major symptoms being fever or chills, particularly fever of 100.4 or greater, or a cough or shortness of breath or other difficulty breathing. The minor symptoms, new loss of taste or smell, I actually think that almost could be a major symptom, but we don't categorize it that way. But it seems that a lot of people that I've spoken with who have had COVID report that symptom. Fatigue, body aches, headache, stuffy nose, things that can go along with other viral infections, sore throat, nausea, vomiting, and diarrhea are all minor symptoms. Next slide. Up to 50% of cases may have few or no symptoms, and I'm sure you're all aware that children may have milder illness than older adults, older adolescents and adults. There seems to be some cutoff around the age of 12 or 13 where the illness is milder in the younger kids. Next slide. So masks really do help to reduce the spread of the virus. They limit the amount of those droplets that are going to come out of your nose and mouth whenever you're talking, happen to cough, or to sneeze. It's not perfect. Nobody claims it to be perfect, but I think that the majority of evidence really supports the wearing of masks when we're around other people to try to reduce those droplets getting over to someone else. Now, the virus is fairly sensitive to drying, to UV light such as sunlight and to most common cleansers, it doesn't survive very well on surfaces. And so that's why hand washing, wiping of surfaces with a good cleanser, and being outdoors can all help to really reduce the likelihood that you're going to get COVID. Next slide. Many people wonder what quarantine is. Quarantine is for people who have been in close contact with someone who has COVID-19. We don't put people in quarantine if they have the disease. That's when we put them in isolation, as if they're actually infected or suspected to have it. But the quarantine is for people who have been in close contact. Next slide. So what counts as close contact? Typically, it's being within 6 feet of someone who has active COVID-19 for a total of 15 minutes or more. Now, that can also include people who are asymptomatic. In other words, if you're around someone for 15 minutes or more within 6 feet, and that person doesn't have symptoms, you still would be considered a close contact. Also, close contacts would be if you provided care for someone who is sick with COVID-19, if you've had direct physical contact with a person who's infected with the virus, if you've shared eating or drinking utensils that haven't been properly washed, or you shared, or they sneezed, coughed, or somehow exposed you to those respiratory droplets. So the basic definition that we use in the health department is within 6 feet for a total of 15 minutes or more. And it doesn't matter whether you've been wearing a mask or not. If somebody has active COVID and you've been exposed in that way, then you're considered a close contact. Next slide, please. So if you are a close contact or have been, then you need to stay at home and monitor your health. And the duration of the quarantine period is 14 days after your last contact with a person who has COVID-19. And the monitoring should include checking your temperature, see if you have a fever above 100.4, cough, shortness of breath, or some of the other symptoms that we've already mentioned. If possible, stay away from others, especially people who are at higher risk for getting very sick, such as those who have diabetes, chronic respiratory illness, immunosuppression, and other things. One of the questions that came through as a prompt to have this session was, what if you have someone in the family who may have been exposed and lives in your household and is a close contact? Do you also need to be in quarantine? You know, theoretically, if you can keep yourself away from that other person, and that other person can self-isolate by wearing a mask, not using the same room, staying more than 6 feet away from you, not sharing the eating utensils, all the things we've talked about, then you wouldn't necessarily have to quarantine. In reality, I don't know how many of us can really do that in the home environment. You know, I would have a hard time, and I don't even have children in my home, but still, you know, being around your spouse, significant others, other family members in the household is pretty difficult, I think. And so many times, household contacts of somebody who has been a close contact will do better to quarantine. But if you can observe the strict precautions, then it's not absolutely necessary, because quarantine people are ones who have been exposed to somebody who actually has the infection. Next slide, please. So here's how to protect others in your home. Try to stay distanced. Use a separate bathroom and a bedroom if possible. Try not to share utensils and other items that haven't been properly cleansed or laundered. Do pay attention to cleaning surfaces and other things that you may have your droplets spread to when you're holding them in your hand or using them. And then washing your hands really well is particularly important. Next slide. Now, this is the last slide, and it's just intended to differentiate isolation from quarantine. And as I mentioned earlier, isolation occurs when a person has been diagnosed with COVID-19. For persons with COVID-19 illness, the isolation lasts 10 days and can be discontinued after the fever has been gone for at least 24 hours without the use of fever-reducing medications, and also other symptoms are improving. There are a few exceptions to that. For instance, some people who've had very severe illness or who have immunosuppressed disorders may need to stay in isolation longer. But for most people, they're no longer contagious after 10 days of the illness. For persons who never develop symptoms, we start the isolation period at the time that they've had their first positive test for the SARS virus. And the same guidelines for home care and protection would apply if you live with someone who has COVID-19 and is in isolation. And a lot of times, just because of the difficulty in separating yourself from another person in your household, the other household members wind up being in quarantine as well. I think it's important to understand that even though somebody may still have a few symptoms after 10 days, and even though someone may even test positive for the virus after 10 days, the chances of them being contagious are really, really small. The positive tests seem to come more from particles of the virus that have been inactivated in the body but can still be detected by the test. So 10 days for most people is adequate isolation. I'm sure that the attendees at this town hall have many other questions, some of which I can answer and some of which I may defer to Sue and others at the school as far as HR policies and things like that. But I'm going to turn it over to you all for those.
Thank you, Dr. Aiken. There was one question that was brought up that is related to the quarantine question, which is, what if I have been in contact but don't live with someone else who is quarantining but who is not sick? So for example, I have a close friend who potentially is in quarantine, but I don't live with them and they're not sick actively. Or I have a student in my classroom that was put on quarantine for some contact that was unrelated to school. Does that mean that our class needs to quarantine? Can you talk a little bit about like the 2 degrees of separation for people that know people who are in quarantine but aren't sick and who don't live together?
So remember that being in quarantine occurs when you're not actively infected with the virus. Now, you may become infected or show the symptoms of the virus during the quarantine period because you were exposed, but you're put in quarantine and you're not considered positive for COVID at that point. So if you were exposed to somebody who later developed COVID-19, it would really depend on the closeness of that exposure and how long prior to the diagnosis in that other person, whether you would need to be quarantined or not. For instance, when we have somebody who has a COVID positive test at the health department, we go back 2 days and we say, okay, 2 days ago, who were you around? Can you tell us who those people might be that you had been within 6 feet of for 15 minutes or more? And those are the folks that we would consider to be your close contacts. So if you have a friend who you hadn't seen for 3 or 4 days, or you had just run into in the store and said hello as you walked past, but hadn't spent 15 minutes with, that wouldn't be considered a close contact, and you wouldn't need to be concerned about that. On the other hand, if you'd had that friend over and had sat around talking for 30 or 60 minutes, and that person within the next couple of days was diagnosed with COVID, you shouldn't, you would then likely need to be in quarantine. The health department nursing staff will make the final decision on that. We have great contact tracers and nurses at the health department who are quite experienced now in deciding who needs to quarantine or not. But the more casual contacts don't necessarily require quarantine.
Great, thank you. Another question that was submitted online is, what is your opinion on masks for children under 10?
Well, there is evidence to suggest that even children under 10 would benefit by, and the people that they are exposing around would benefit by wearing masks. I think that it's certainly appropriate to have intervals when the children can take their masks off for a bit, making sure that they're either outdoors or well distanced from their classmates and staff at the school. But in general, we really would want to try to have masks on the younger children over the age of 2 for the majority of the time, especially when they are in a classroom setting where the distance is 6 feet or give or take a few feet. The American Academy of Pediatrics and the CDC both still recommend mask wearing for children over the age of 2 in the classroom situation, and I support that.
Great, thank you. Sue, did you have other questions that you wanted to bring up before we open it up to the group?
Yeah, let's see. One question I've gotten a lot, of course, most of you know, we have some students who are now in different kinds of situations, whether they're self-isolating, been out of school too many days, and so now have to spend more days or whatever. And the teachers are asking me, are they in quarantine? Who is the case? And things like this. And I just really want to emphasize that that's confidential information. And if it's going to impact a staff member or other students, we'll get that information from the health department and we will surely pass it on. We might even have some parents that call in and say, my child's in quarantine, can they please have some homework? It's okay for parents to tell us that if they're comfortable with it, but that does not give us permission to share that information out in any way, any more than we would share other confidential health information. So I just want us all to be really careful about, it's a natural inclination to say, who is it or why are they gone? But we're only going to share information that you need to know, and we ask you not to share that information with anyone unless you know you have expressed permission from the parents to share that. So I keep getting calls, who's the case? Or is this child in quarantine? Why are they out so long? But I just want you to know that that's not information that I can really share unless you have a real need to know it. There was another one. That was the main one I wanted to say. And while you're going to open it up, I might think of some others, Carol.
Okay. So I should be unmuting everybody, hopefully, or you can unmute yourself if it didn't work. And go ahead and ask any questions that you have to Dr. Aiken.
I had a question.
Sure.
We wash our hands a lot in life skills, and we're finding that our hands are red and raw and sore. I'm wondering if you have any suggestions that could help. Like, is it okay to use like a towel rather than the rough paper towels, or a better suggestion on lotion or soap or something else that might help reduce some of this? Because we're finding that by the time we hit Friday, our hands are so red and raw and sore that we're just looking for ideas that might help reduce that for us some.
So are you talking about the staff members in particular? Yes. Or everybody, the staff and students?
Staff more than students, but our students are washing a lot as well. Okay. So yeah, I'm just open for suggestions.
Okay, and so we certainly really care about the integrity of your skin, because if your skin starts to crack and all, you're kind of like, you're kind of a setup for infection. So we don't want that. One thing that you can do is, after you've washed your hands, to pat them dry instead of rubbing them dry. That's less hard on the skin. And I can only speak anecdotally. I cannot give you evidence-based practice, but I know when my hands break down, especially in the winter and they crack wide open, I use just Purell lanolin, bag balm is another name for it, in the evening when I'm sleeping, so that my my skin has an opportunity to heal itself overnight. Dr. Aiken or Bobby, you can talk to that about whether I just learned it being a nurse or whether it's real. But just trying to replace some of those oils that protect our skin in the night, and especially on the weekend, is one of the helpful things I can suggest.
Thank you, Sue.
Yeah, I mean, I agree with the use of a lotion, and I think everyone has their favorite lotion that they really think works well, and I don't see a problem with that. Also, sometimes a milder soap, a lotion soap, or something like, I don't know, Ivory. I mean, there are a number of different soaps that are a little bit milder. So those would be some suggestions that I might make. Certainly, it's hard, you know, in healthcare, we're cleansing our hands a lot all day long, and I find too that my hands get dried out, and I often have to use a lotion. Bobby, I don't know if you have any other thoughts on that as well that you could share.
No, I think you guys have touched on pretty much everything that there is to do. It's just unfortunate that it is a side effect of washing our hands frequently, but it's something that we need to do. And there's no reason why you can't apply lotion even after washing your hands. So, but definitely put it on at nighttime before you go to sleep. That definitely does help. So yeah, it's really there's not an easy answer for that one, I don't think.
And it doesn't have to be antibacterial soap. And I know that the soap in our dispensers is not antibacterial soap, but if you've perhaps gone out of your way to get antibacterial soap, you don't have to use that. It's really that 20-second friction rubbing that's really getting us clean. So the antibacterial soaps are a little rougher. So just you don't have to use that. You don't go looking for that if you were doing that. Also, if you're giving the children hand lotion after they wash their hands in the same interest, I would just ask that you dispense it, like you have them hold their hand out and you squirt it. So only one person touches the lotion dispenser, and we don't have a lot of hands on it, or it becomes a source of infection, ironically.
Is it okay for us to put lotion on the kids after hand washing, Sue, or do we need parent permission to do that?
At the younger grades, I know the parents have to sign for chapstick, sunscreen, and lotion. I really don't know about the older kids. It's not treating anything, it's prevention. And of course it's treating we need permission for. But that is a good question. And I would have to reach back into our actual school district policy about that to remember.
Okay.
Thank you. Other questions that people have for Dr. Aiken or Bobby or Sue?
Let's see. Oh, I have a question. I have a commonly asked question. Must I provide a note of a negative COVID test? So initially I was asking for this, but then I thought it through. If I have a staff member or a student that tells me, oh yeah, we're gonna go get a COVID test, and then they tell me verbally, my COVID test was negative, I really don't have a problem believing that, because frankly, if it's positive, Bobby's gonna be calling me. So I think the fact that I'm not getting called by our health department is an implied, yeah, the COVID test was negative. So don't lean on yourself or your doctor or the parents to provide a note of clearance for a negative COVID test, because we'll get a positive one if it really matters. So let's let that go. And then I know that some of you are kind of confused because a kid will be out for, I don't know, 3 or 4 days. Then they'll come back, then they go to the nurse's office, then they go back home. So you're getting worried perhaps that they maybe have COVID after all or something like that. Let me just reassure you that when you're having students out for more than 3 days, we're tracking that. Actually, we're tracking it at the first absence, and then we're watching when they come back and what their symptoms were. And if they're out for more than 3 or 4 days with COVID, at least one major COVID symptom, we want to either know that they saw a doctor, had a COVID test, or that that they're willing to stay home for 10 days. And what's happening is they're gone for 5 days, sick with a cough. They come back, they're not cleared, they're still coughing. We then might send them home and say, please finish our flow sheet, which means you've been out for 5, we need you out for 10, and you're more than welcome to come back after that. Or if you would like to see a doctor, certainly if your child's been coughing for 5 days, we recommend that. If they bring a note of clearance, then they can come back before the 10. But remember that when we have a student with symptoms and the symptoms don't clear up in 2 to 4 days, especially the minor ones, I'm giving them more time to clear up. I really do need to know that something more is happening. Either they're seeing a doctor, they're getting a test, or now they're going to stay out for the full possible period when they might be infectious. Remember, Dr. Aiken said after 10 days, you know, they're probably not infectious anymore, even if they had COVID and never knew it. So that might explain why sometimes you're seeing children out for 5 days, come back, and then going back home. And I know that that's alarming to you, but just know that we're just trying to follow our flow sheet to make sure that we're not missing something.
Thank you, Sue. Other questions from people on the call?
Some of you might be wondering where you can get a COVID test and when you should get a COVID test. So I'm going to wait, like, you know, give you some time to ask a question. And if I don't get any questions in like, you know, a minute or so, I'm going to answer that one.
I'm going to go ahead and start to answer that question, Sue. You know, there are several ways that you can get a COVID test. One of those is to go through your primary care provider. All of the primary care providers in our area are aware of how to get a COVID test ordered and can walk you through that process and give you an order. Another way to get it is at the drive-through COVID and flu testing over at Southwest Health System by the EMS building. That drive-through is designed to test people who do have symptoms. And we have the hours on that from 8 a.m. until 2 p.m. every Monday, Wednesday, and Friday, and from noon until 6 p.m. every Tuesday and Thursday. So if you had symptoms, didn't want to contact your primary care provider, you could go to the drive-through testing for either a COVID test or a flu test or both. Those are the major ways. Cedar Diagnostics, which is a laboratory based in Cortez, also offers COVID tests. I believe you have to schedule an appointment there. I'm not sure what their wait time is on that.
And our insurance covers the COVID test, so bring your insurance card wherever you go. Dr. Aiken, would you talk about, should they go immediately if they feel lousy when they wake up, or should they wait 24 hours?
It's best to wait 24 hours. If you wake up with a fever or cough or shortness, if it's severe shortness of breath, you shouldn't wait. But a fever, chills, a cough, body ache, some of the other symptoms that we talked about, it's best to wait 24 hours. Number one, to see if the symptoms just go away on their own. And number two, because the test is more likely to be positive after you've been ill for 24 hours if you have COVID. I'll relate a personal story that sometime 2 or 3 weeks ago, in the middle of the night, I was having chills and fever. And I can tell you, I was really tempted when I got up the next morning to run and get a COVID test. But I tried to follow my own advice. And within 12 hours of the onset, the symptoms completely disappeared. And by the next day, I felt fine and have felt fine since. So a COVID test was unnecessary and probably wouldn't have been positive that early in the course of the disease if it had been COVID.
And if you were an RE1 employee, you would have been allowed to come back to school in 2 days because your symptoms had cleared up. Because that's our flow sheet. So that's really important. We are tempted to wake up lousy and go run off to get a test. It's better to call in, say you don't feel good, tell us your symptoms so we can track you, and just sit home for a day or sleep for a day and see how you wake up the next morning before you actually go to seek a test. That's just gonna work out better for all of us, because also then we wouldn't use up all the rapid tests before we might really need them, which will be, do you think, Dr. Aiken, or no?
You say we'd use up all the rapid tests?
Yeah.
Yeah, I mean, we are trying to do in-house testing at Southwest Health System, and we're quite fortunate in Montezuma County to have that available. Most places have to send their tests away, and we still do send tests away to a reference lab for people who don't have symptoms, or for those who, their primary care provider decides that it really isn't vital to have an immediate result. But there has been recently a slight shortage of the in-house tests, which give a result within 8 hours or so, because the manufacturer is upgrading their facility. So in the short term, that is a factor. Hopefully in the long term, another few weeks, we'll have plenty of tests and wouldn't be quite so worried. But the point of the test being more likely to be positive after 24 hours is important. If you get a test right away and it's negative and you're still symptomatic the next day, you'd be possibly getting tested more than once, which isn't the most pleasant thing to have happen. So,
Yeah.
Thank you. There's an email. Sue, can you clarify if you're the person to call if a staff member calls off? You don't have to call me. If you call Tanya, the substitute person, she's going to get me the message, and we're getting information from Tanya. We're getting information from the office registrars to let us know when staff members are out and what their symptoms are. So if you could specify what your symptoms are when you call off, that will determine whether I will track you and support you, or if it's a doctor's appointment or whatever, you don't have to say. But just do say if you have COVID symptoms, so that that I can support you and watch you, how many days you're off and things like that. You don't have to call me directly. I will get the information through our tracking system.
Yep.
Let's see. So that's good. A lot of people have asked me where to go to get a test. So thank you for covering that.
For our employees, also remember that we have telehealth. So if you wake up in the middle of the night and you just want to talk to a doctor, you can also use that service to answer your questions in the short term.
I'll just throw this out there. How are you doing for PPE? Is anybody needing more masks? I have face shields, I have masks. Remember, our special needs students, you're doing intimate contact with them when you're in the bathroom with them for so long. Please wear a gown and a face shield or goggles when you're with them, because that is a fairly long period of time for intimate contact. And I have more gowns, I have all that stuff. So if you're starting to run out, certainly you can reuse a gown as long as you only reuse it for that same student. But just know that there's more PPE out there. Anything you need, I have. So you can always reach out to me if you're starting to run short of anything, or if somebody got a face shield free through the school and you feel like it's getting kind of ratty or disgusting, you can wash it with soap and water. But if you feel like you need a replacement, I have those too. So just know this whole town hall is for teachers. So there's a lot of things I just want to be able to tell you, that we are supporting you as best we can. And some of the things, some of the tracking might seem a little frustrating. but it's all about trying to keep you safe as we learn to navigate this path.
Thank you, Sue.
Yes. Sue,
Hmm.
how often would you suggest that we change out the gowns?
I think, I mean, I could say till they get disgusting, but let's be more specific. How about once a week? You know how we ditch everything on Friday and start fresh on Monday? That's a nice rule of thumb. If you feel that that's being too wasteful, you can make it go 2 weeks, but I have materials. I would rather you be comfortable and clean and, you know, just give every student's caregiver a new gown once a week would be fine. Just make sure you're hanging them on separate hooks so that this child's caregiver always uses that gown, you know, like that.
And if we need replacements, do you want me to just send you an email?
I have
Okay.
them.
Okay, thank you.
And you know, if you don't feel comfortable in the face shield, you can wear goggles. Just don't assume that glasses like these are protective, because they're not. You need something that encloses your eyes like so. So either something over top or goggles over top of your glasses. That's how you're going to protect yourself from the eye infection.
Any other questions from people on the call?
I have a question. So could you just clarify with the response flow chart, if there's a student who has symptoms, but the parents choose not to get a COVID test, and how a decision would be made for quarantining?
So remember that it wouldn't be quarantine because they would actually have symptoms. So when you talk about someone, if I have symptoms, I isolate. So, okay. So a parent, the child's coughing a lot, but the parent says, can't be COVID, or doesn't believe in doctors or any other kind of a reason they don't want to seek health care and they don't want to get a COVID test, that's their right. And that's why the third option is to stay home for 10 days. So they can see a doctor, they can either clear their symptoms in 3 to 5 days if it's minor, or 2 days if it's major. They can see a doctor and get a note of clearance. They can get a COVID test that comes negative, or they can keep their child home for 10 days. Those are all fine, acceptable choices, and we'll just mark them out.
So does that mean we would only quarantine a group if there was a positive COVID test?
Correct. And we find that out 2 ways. If the test is school related, if the positive case is school related, we'll get a call from the health department from Bobby B. Locke. She's over there. We're looking at her today. And if it's a case is not school related, say uncle tested positive and now all the children are in quarantine from that family, usually the parent will call me or somebody and say the child is out for the next 2 weeks. They don't have to tell me they're in quarantine. I don't have to tell you they're in quarantine. It has nothing to do with the school. They're just basically staying away from school. So that's who gets quarantined, is somebody, like Dr. Aiken said, who came in contact with a case. Did I answer your question?
Yes.
You know, I'm going to make another comment about that, just to clarify. Right now, we're very fortunate in Montezuma County to not have a significant prevalence of COVID-19 disease. Certainly, we've had cases and we'll have more cases, but it's not like some areas where there are a lot of cases active all at once. And thus, I think we have the flexibility. If we had a child who was symptomatic and whose parent preferred not to have that child get the test, and therefore that child isolated for 10 days, we have the flexibility to say that that's not likely to require quarantine for kids that had been exposed to that child prior to the onset of the illness. If, however, we started to see an increase in number of cases of COVID to where we thought that, such children it may really be highly likely to have COVID disease, then we may have to change that. We may have to say that's a presumed case, and we would be looking at the possibility of quarantining. Bobby, would you say that that's a fair assessment? I don't mean to put you on the spot. I mean, I just think that, you know, if you have a lot of cases in the community, then we need to be more cautious. Right now, we don't, I think we're very safe in not having to quarantine children who might have been exposed to someone who's not willing to get a test.
Bobby says, I just got disconnected, but yes, I agree.
Okay.
And I just want to add and thank and acknowledge both Dr. Aiken and Bobby and the other members of the health committee for that type of guidance, is that there is a lot of considerations depending on what the community context is as well. And that's one of the reasons why we have the Health Advisory Committee, is because those folks have the expertise, not only from the research and the medical lens, but also knowing what our local community context is. And that is invaluable to guiding us and making informed decisions in terms of implementing our plan.
And I don't see any school registrars or like attendance secretaries on this call, but I hope if they have an opportunity to see the recording later, anytime a parent calls in, if you could ask them, remember we gave you that paper for keeping attendance with all the symptoms on it. If you could ask them what the symptoms are, that really helps me to weed in or weed out who I want to track, who has symptoms. And even though we're a low transmission community, I watch kids, and I'm watching kids who are gone for 5 days in a row with a cough. Most of them, you know, have allergies or have the cold you get when you come back to school. It's all one big word. But we don't want to miss anything. So as much information as you can get from parents when they call a child in sick really helps us to keep track of the people that we want to make sure are, you know, affecting or not affecting our community in terms of COVID.
Thank you, Sue. Any other questions that anyone on the call has?
I hope you all got the Can I Go to School Today paper. That's our screener.
I have another question, just thinking about the community context. I've noticed, just like going to the grocery store and shopping around town, that there's a lot of people in this community who are not wearing masks, especially compared to like in Durango or Farmington. And I'm wondering, like, are there any examples of things that school districts, perhaps around the state or the country, have done, like awareness campaigns for the community about the importance of these health precautions and how they can impact schools?
I think that information is coming from health departments, other community groups, probably schools also. I mean, mostly what we're saying is, in order to keep a safe school, we need to wear masks in school. And we're kind of focusing on school as opposed to the bigger community, because that's a population we can have an impact on.
And so this is Bobby. Sorry, I got disconnected on the line here, but I think that's a great observation. I think that modeling behavior is probably the best thing that we can do. And I do think that our community, I think there's a lot of people wearing masks in our community, and I think that's why we're not seeing such a prevalence as other communities may have. We are on Facebook, we are putting out messaging around masking. We're doing what we can to encourage the behavior, but there's also, you know, there is the other side that does not believe in masking. So it's hard we have to walk that line so that people, you know, have choice. and those who don't want to wear them aren't going to wear them. But as far as modeling the behavior for children, I think that's critical. And so as employees of the school, I really, from a public health perspective, really appreciate everyone who is wearing them, because that does set the example that we want those kids to be wearing them, and those families who are wearing them, we really appreciate that as well. So we're doing what we can, and I think so far it's working. So we'll see, but I do appreciate the comment. So
Yeah. I feel like in school, our kids are so glad to be back to school. The compliance, there's always a few, but I think the compliance has been so good because kids really want to be in school. And if that's the rule, that's the rule. And if that's the incentive, I don't really care what the incentive is, as long as they wear the mask.
Great. Well, thank you, everyone. This has been recorded, and we will make it available to teams and individuals that weren't able to attend. Like I mentioned earlier, a couple teams had requested a recording since this interfered with their work hours. But Dr. Aiken, we really appreciate your time. Bobby, we really appreciate your time, not just tonight, but throughout this process. Your support and expertise have been invaluable. And I agree. I think, we are grateful that we have had these, first 3 weeks with our students. And I think the students are very grateful to be back, and we appreciate all of the support from you, and then also from all the teachers and the staff on the call in helping us implement the plan in a way that provided that opportunity. So thank you, everyone, and have a good evening. And if you have other questions, or your colleagues have other questions, please have them email Sue, and we'll try to get you the answers.
Great.
Bye.
Thank you so
everyone.
much. Bye-bye.